Lots of us have felt worried about the coronavirus pandemic, and everyone will feel differently about the changes to lockdown restrictions. If someone's feeling anxious or worried, you don't need to be an expert on mental health to support them. Being open to mental health issues doesn't have to be awkward, and being there for someone can make a huge difference to their life. But there are a lot of myths about mental health problems, and they often contribute to the stigma that many people still face. It's important that we challenge these myths so we can understand the real facts around mental illness and what we can do to help. Myth number 1, mental health problems are rare. According to research with over 16,000 people, we know that more than half of adults, 60%, and over 2/3 of young people said that their mental health got worse during lockdown. We know that many have developed new mental health problems as a result of the pandemic, and for some of us, existing mental health problems have got worse. Prioritizing mental health has never been more important than it is now. The simple answer here is that all the evidence indicates that they aren't rare at all. Around 1 in 4 people will experience a mental health problem, and that proportion could get higher as we go through this difficult COVID-19 journey. This means that right now, someone you know might be struggling with mental illness, and that someone might even be you. So if it is, know that you're not alone. Lots of people are struggling right now. Myth number 2, people with mental illnesses aren't able to work. People with a mental illness can hold down a successful job. We all probably work with someone experiencing a mental health problem. Good mental health at work and good management go hand in hand, and there is strong evidence that workplaces with high levels of mental well-being are more productive. Addressing well-being at work increases productivity by as much as 12%, so organizations benefit in more than one way too. Awareness of mental health is increasing, but we still face a world where people with mental health problems face discrimination and can face challenges getting the help they need. Many people who experience distress try to keep their feelings hidden because they are afraid of other people's responses. Fear of discrimination and feelings of shame are among the top reasons people give for not telling their colleagues about their mental health problems. But when we create workplace cultures where people can be themselves, it is easier for people to speak about mental health concerns without fear, and easier for them to reach out for help when they need it. Even so, the decision to disclose distress at work is not one people take lightly. So it's vital that workplaces become environments where people feel safe to be themselves. Myth number 3. You can't recover from mental health problems. Most people with mental health problems can get better. Treatment and recovery are ongoing processes that happen over time. But around 65% of people experiencing symptoms of a mental illness don't seek help from health services. About 40% of women get help, but for men, it's fewer than 30%. The first step is getting help. Mental health problems might not go away forever, but lots of people with mental health problems still work, have families, and lead full lives. Myth number 4. People with mental illnesses are usually violent and unpredictable. The vast majority of people with mental health problems are no more likely to be violent than anyone else. Only about 3 to 5% of violent acts can be attributed to individuals living with a serious mental illness. In fact, people with severe mental illnesses are over 10 times more likely to be victims of violent crime than the general population. Myth number 5. Young people just go through ups and downs as part of puberty. It's nothing. We are seeing epidemic levels of stress in children and teenagers with increasing rates of clinical depression, anxiety, and other coping problems. Fear, uncertainty, and lack of control, factors that power stress, are ramped up in times of rapid, unpredictable change. And puberty is a time of massive change: hormonal, physical, sexual, social, cognitive, and neurological. We know that 1 in 8 young people will experience a mental health problem, so we need to pay attention to this. Find out more in my video about how to tell the difference between changes brought about by puberty and mental health issues by clicking this video up here and checking the video description. Myth number 6. I can't do anything to support someone with a mental illness. Lots of us have felt worried about the coronavirus pandemic, and everyone will feel differently about the changes to these lockdown restrictions. There are lots of things you can do to make a difference to your life or someone you care about. Think about using these 3 tips. First, check in. If someone doesn't feel ready or safe enough to meet face to face, picking up the phone, having a video call, starting a group chat or messaging someone on social media lets them know that you are there to talk and ready to listen. Second, listen and reflect. Whether you have a mental health problem or not, this will be a challenging time for our mental health and well-being. If someone opens up to you, remember that you don't need to fix things or offer advice. Often just listening and showing you take them seriously can help someone to manage. Third, ask questions. Ask how people are managing, and ask again if you're worried that they aren't sharing the full picture. Asking again with interest can help someone to open up and explore what they're feeling. You might also find this video by me helpful. Thanks for watching. My name is Dr. Saab Johal. Be sure to subscribe for more videos from me. Take care and go well.